Welcome to the Mind Buying Podcast, where we challenge the stigma associated with mental illness through conversations about a variety of issues impacting mental health. Here we bring you news, views, and interviews that intrigue, educate, and celebrate recovery. Leading us on this journey are the hosts of the Mind Buying Podcast, Darryl Mathers and Chris Bovey.
Welcome to the Mind Buying Podcast. My name is Darryl Mathers. My co-host, Chris Bovey, is not participating in the filming this afternoon, but we have two great guests, and this is actually the first podcast that we're filming back on site on Ontario Shores. So we're not in our regular studio, and my guests are actually from Ontario Shores, but we're in different areas of the hospital to ensure physical distancing, and then we're keeping ourselves and everyone around us safe. So we're still using Zoom, but many of us are back on site, and I want to give a big shout out to everybody that was here throughout the pandemic on site and working remotely to carry on the business at Ontario Shores. It's certainly a challenging time for the world, but it was in particular, it was a challenging time here. I'm really proud of everyone who rose up or was rising up during the pandemic to provide quality care and facilitate the operation of the hospital since March. So it's great to be back on site, even though things are different and we're living in protocol and procedural world. It is nice to see familiar faces and get back to some of our normal business. So today we're going to talk about a few different things related to COVID-19, but in particular the flu season. So we are about to embark on our own influenza campaign here at Ontario Shores and throughout Ontario. And to help us in this conversation, we have a few guests from Ontario Shores. I'd like to welcome as they come on board. We have Anson Kendall from our infection control department here at Ontario Shores. Welcome, Anson.
Thank you, Darryl.
And we have Dr. Dave McNeil from our med clinic. Dr. McNeil, for some of you who don't know, our hospital is full of psychiatrists. We don't have too many medical doctors, but Dr. McNeil is that team. Welcome, Dr. McNeil.
Thanks very much, Darryl, for having us.
So I was just introing kind of what we're going to talk about today, and obviously for the last 6 months, like the rest of the world, we have been embarked on this journey through COVID-19 and trying to get our minds around how we're going to operate in this world safely. And we are now into September. We've been on this since March, and maybe I'll start with you, Anson. Like, as an organization, I know you're in touch with the public health unit in Durham and with our provincial partners as well. Where are we at this stage of the COVID-19 pandemic?
Yeah, thanks, Darryl. So what I'll do is I'll start, I guess, really high, at a global level, and then I'll go down to the Durham region. So as of today, September 23rd, our global cases are just over 31 million cases, and that's driven primarily from India, Brazil, Russia, and Colombia. And in terms of global deaths, there's just under 1 million at about 972,000. The US, Brazil, and India are the top three countries in terms of global deaths. And in Canada right now, we have just over 9,000 deaths, with Quebec, Ontario, and Alberta being the top three leading provinces there. When we look at North America, the United States just is approaching pretty quickly to 7 million cases, and Canada, on the other hand, has 147,000 cases. What we're doing when we look down to Durham region, we have just over 2,000 cases. And Pickering, Ajax, and Oshawa seem to be the top three regions in Durham that have the highest cases. So that kind of gives you a top-down view of what's going on. We are seeing numbers rise as we get back into the fall season and as schools resume. So it'd be interesting to see how the next couple months play going into the holiday season.
I was going to, follow that up, whether it's Dr. McNeil or yourself, Anson. Right now, we're at a kind of an interesting time in the world. We are, like as we mentioned, 6 months into this. In Ontario, cases are starting to rise. In other parts of the country, they're starting to rise. And you're hearing this term, COVID fatigue, and part of that might have to do with the reopening of provinces. But why when I hear those numbers, especially if I'm a Durham resident, it doesn't sound too bad, right? It doesn't sound like a lot of people when you consider our population. So, why should residents of Durham region, of Ontario, or staff, why should they really be concerned about those types of numbers?
That's a great question, Darryl. We know from our experience in March and April and May that that these numbers, these case numbers, or the amount of transmission that can occur in the community and within our institutions and businesses can exponentially rise. So we've seen just over the last couple of weeks, a threefold rise in our case counts. And these things are very, very disturbing to the epidemiologists that are following. And there's many warning signs now that we may be coming into a second wave that will be complicated by also the reopening of the economy, the reopening of schools, and of course one of the things that we're here to talk about today, which is influenza season.
Before we get into, go ahead, Anson.
Oh, no, I was just going to add to what Dave was saying. When you look at influenza and you look at the mortality rate of influenza as it's compared to COVID-19, we're seeing that the influenza mortality rate is roughly around 1%. And we've seen COVID-19 mortality rates to be in and around 3 and 4%. So with that being said, as a Durham resident and just as it's something to be concerned about, definitely.
Before we get into the flu season and how that factors into all this, people may look at Ontario Shores. We're not, a so-called traditional hospital. We're not an acute care hospital. Being a specialty mental health hospital, we have unique populations. All the way from adolescent to geriatrics and forensics and adult psychiatry and a bunch of other programs and services that I couldn't possibly name. But we have a wide range of services. So somebody on the outside may look at us and say, how is a mental health hospital impacted by COVID-19 more than a business? So maybe give people just a sense of what we've had to do and what our staff have had to do to keep our patients and staff and families safe during all this.
I can answer that, Darryl. I think that's a really good question. I think when we look at our patient population, it's very difficult to implement infection control measures when our patient population suffers from mental illness. Some of our patients do not know what it means to wash their hands and why they should wash their hands. They may not understand the need for personal hygiene and regular bathing and showering. Also, some of our patients may not understand why it's important to finish a course of antibiotics. So with our patient population, it definitely presents challenges. Also, some of our patients at Ontario Shores live at Ontario Shores, and this is their home. And with that being said, it's very difficult to put infection control measures in place in somebody's home.
Yeah, I'd like to add to that as well, Anson. When you look at our patient population, it is very diverse, as you mentioned. We do have a very large geriatric program with 3 large and active geriatric units. We know that at the beginning of the pandemic, the devastation that was caused in our nursing homes, we've been very fortunate to have 0 cases within our hospital, and especially 0 cases within our geriatric program because of the very, very high mortality rate of this particular virus with people over 65 or people with comorbid medical conditions. Now, many of our younger patients here in the hospital do have medical comorbidities. In fact, when you look at people with mental illness, we have diabetes rates that are approximately 3 to 4 times that of the general population. We run about 20% of our population has diabetes. We have very high rates of heart disease and pulmonary disease. If you have a psychosis, your chance of being a smoker is about 80%. So that's compared to 15% of the general population. So we have a very at-risk population, and one that we've taken a lot of effort and a lot of thought into protecting our patients and our staff from the COVID-19 virus.
So moving into influenza, which I know at Ontario Shores and hospitals across the world, it's always a point of emphasis every calendar year when we get into those colder months heading into winter. And, we have our own campaigns. So we'll talk a bit about ours in a bit. I know the province just announced the other day their largest order of vaccines for influenza, the largest campaign in its history. So while we're waiting for this magical COVID-19 vaccine, which, who knows, when and if we'll see that, why is an influenza vaccine, why is getting immunized at this time in our history so important?
I'll take that, Darryl. Go ahead, Dave. Go
right ahead, Andrew. Go right ahead. You go.
Okay, I was going to say that I think it's very important because between influenza and COVID-19, they're both symptomatically indistinguishable. So without a laboratory confirmed test, you wouldn't know, or the patient wouldn't know if they have COVID-19 or if they have influenza. Also, with an influenza vaccine, the vaccine would mitigate the chance of severe complications of both COVID-19 and influenza. So we may touch about this later throughout this talk, but there is a possibility of a co-infection with both influenza and COVID-19. David, I don't know if you have anything to add to that.
Yeah, Anson, that's a great point. Just as a clinician, if I'm called to see somebody with a cough and a fever or fatigue and conjunctivitis, it's a very difficult when you see folks, that are febrile with respiratory illness, to try to determine what exactly you're dealing with. Are you dealing with a common cold? Are you dealing with COVID-19? Are you dealing with influenza? And we're going to be going to what we call a multiplex swabbing, because we're going to have to rule out COVID with every single one of these cases. And the multiplex swabbing will allow us to also isolate the various strains of influenza A and B. So it's going to be very complicated for patients or staff who develop these symptoms, because they will immediately be placed in isolation, either from work, a home isolation if you're a staff, or if you're an inpatient in the hospital into contact droplet isolation until COVID can be ruled out.
In addition to what Dave's saying, vaccination will also help to not overwhelm the healthcare system with influenza hospitalizations. So that's another, benefit of influenza vaccine.
And to break it out even further, sorry, I was just going to say, to break it out even further, Dr. McNeil mentioned, the impact it has on staff in terms of isolation if they develop symptoms until they're ruled not to be COVID-19 and the implications of that. But that could be said for a multitude of workplaces and in schools as they're reopening, for people that want to be able to go to work day in, day out and provide a living. Having your immunization may help in terms of that isolation period or not having to experience that.
Yeah, I think prevention is the key, Darryl. The best thing we can do is not to ever develop these symptoms. And we know that we have a safe and effective influenza vaccination. So if we can prevent influenza infection, then we're one step ahead. We never have to deal with this with diagnosing the symptoms and the isolation and all the complicated things that occur after you develop those symptoms. Prevention is always the key, and by prevention, the vaccination is very important, but also hand hygiene, social distancing, avoiding large gatherings, wearing your mask appropriately. These are all things that we like to really drive home during influenza season, and even more so this year because we've got this other deadly virus in play, and we have to look at vaccination as one part of the solution, but a very important part, and one that we have total control over as well. Every year around
flu season, there are kind of camps of people's perspectives on being vaccinated. I'm not necessarily talking about anti-vaxxers, which is another conversation, but people who, for whatever reason, whether it's personal beliefs or myths, choose not to get the vaccine. And so I wonder, given you're both obviously pro-vaccine and very passionate about it, what do you say to people that may have had some apathy in this area before?
So one of the analogies that I like to use, Darryl, is when people say, I don't get the vaccine because I don't get sick. And one thing, sometimes I say, well, that means you don't wear a seatbelt because you don't get into accidents. And the thing is, we don't necessarily know when you're going to be exposed to the influenza virus. You could be pumping gas, you could be at the bank, you could be here at work, and the opportunity exists for you to have that virus, right? So I think what we try to say is, because you don't know, and going to what Dave said earlier, we want to be able to prevent this from happening, and the vaccine helps with that prevention.
Yeah, as well, one thing I hear all the time is, I got the vaccination last year and then I got the flu. In other words, either thinking that the vaccination itself gave you the flu, or that you're not 100% covered. So that's partially right and partially wrong. The vaccination cannot give you the flu. It's scientifically impossible for that to occur. The vaccination itself is made of what we call attenuated virus. It's not live virus, and it can't cause the flu. The fact that you can get mild cases of influenza if you've been vaccinated, that is true. The vaccination itself is not 100%. It usually runs in the 70 to 80% efficacy rate as far as protecting you from the flu. However, if you do contract influenza and you're vaccinated, your risk of having a longer course or more transmission to your family and your patients, or worse symptoms, is lessened quite a bit. So the vaccination itself does boost your immunity. It does help protect you from the flu, even if you do catch a very mild case of influenza.
So somebody that may have received the flu shot and is not feeling well after, they may say that they got the flu from it, but what are they actually experiencing? Is it a side effect? Is it just a reaction? Because it does happen. People do get the flu shot, from my experience, and maybe not feel great after. Not necessarily did they get the flu, but something happened there. So what are some explanations for that experience?
Yeah, that's a great question, Darryl. That's a great question. And with any vaccination, be it the influenza vaccination, or if you get a tetanus, diphtheria, or any vaccination, you can develop a little bit of an immune response. That's the idea of the vaccination itself. Is that it stimulates your immune system to develop antibodies against the virus, and that stimulation of your immune system can actually make you feel a little bit sick or a little bit fatigued, and it's not uncommon to for a day or two to feel not 100% afterwards, because your body is in the process of making an immune reaction.
And just to add to what Dave was saying too, it takes about 2 weeks for the immune system and the flu shot to actually work. So I think with that being said, and what Dave was saying earlier, in that time, it's not uncommon for you to feel a little bit groggy. Also, there's some site pain where the needle has been injected into the arm. And some people report, some site pain up to 2 days after they receive the vaccine.
So here at Ontario Shores, we're still in September. We're approaching, kind of the start of flu season, which maybe unofficially at the first of the month here, a few days later. And we're still to launch our kind of theme for the year, and we've kind of taken a bold strategy, if you will, or statement, making a bit of a bold statement with our campaign slogan, which is #0flu. We rely on you. And I think the idea being that we've set out a goal for 100% immunity, which around here, would surpass, kind of would surpass any average year, any number we would have set out previously. So I wonder what you guys think of this idea of going, kind of shooting for the stars, if you will, as an organization, and messaging to our staff and our community that we need everybody on board?
I think this year, more than any other year, that message is actually really important. And I do feel that even though it may seem to be a stretch target, we'll be very surprised that a lot of people will be getting their vaccine just because of the possibility, like I had mentioned earlier, of co-infection with COVID-19. And also because we don't know how severe the influenza season will be. In addition to some of the other infection control measures, vaccination will play a very key role, and this should help to reduce the impact of the influenza season. I think this year would be, even though it is a stretch target, like you had mentioned, I think there's a good chance we'll have a high vaccination rate. I don't know, Dave, what do you think?
Yeah, I mean, Anson, who would have ever guessed that we would be in lockdown, right. back in March and April? Our economy was decimated. The fabric of our lives completely changed, with the onset of the COVID-19 pandemic. This is a very, very special year, and it's a very special year where we are, we're determined to beat this pandemic. There's a huge risk that's facing us right now, and that is the intersection of influenza with COVID-19. And to many of us, and all of us have made sacrifices. To many of us who have made many, many sacrifices over the last 6-7 months, we don't want to lose because we failed to vaccinate, or we failed to continue on with our infection control processes to avoid getting influenza, to protect ourselves from both influenza and COVID-19. It's a huge challenge. It's a huge challenge for all of us. We have to keep the hospital ICUs below capacity. In other words, we can't fill up with influenza season as we do every year. The ICUs are full of influenza patients. Influenza kills 3,500 Canadians every single year on average. And what happens when if we have a strong second wave of COVID-19 and we have a strong influenza season, we are going to have overwhelmed hospitals, overwhelmed ICUs, and there's going to be a lot of people die. And this is something that we can prevent by strong infection control practices, and that includes influenza vaccination. And when available, if we can get COVID vaccination, that's no time soon. But the vaccination against influenza is just so important this year, even compared to other years.
I think you kind of touched on it, how the fabric of our lives have changed. And, I mentioned earlier this COVID fatigue. I think we're all kind of feeling that, like, it's been 6+ months. We want our lives back. At times it feels like we're getting there, and then with this current wave, it feels like we're in a bit of a setback. But getting your vaccination for influenza is something we can all do, to help move this along a little bit further. Because if we are filling up ICUs, if we're not vaccinated and we're exposing more people, potentially this could last longer. Could it not?
Yeah, no, absolutely. Absolutely. And, we vaccinate to protect ourselves, but we also vaccinate to protect our families, our children, and our elderly parents and in-laws. As healthcare workers, we have a huge responsibility to care for our patients and to not expose our patients to influenza. And that professional responsibility and that humanistic responsibility, I think, should make people who have decided not to vaccinate in the past really think about it and think about it seriously. What we're here to do, and then look at the science. And we know we have a safe and effective vaccination, and make the right choice.
Just to add to what Dr. McNeil just touched on, influenza poses the highest risk at the extremes of ages, so those under 5 and those over 65. And with COVID-19, what we've seen that it somewhat spared the pediatric population. Not to say that if a pediatric patient comes down with some of these symptoms, they do not have COVID, but we're really seeing the effects of the COVID-19 virus in the geriatric population and them those highest at risk. So therefore, I think with the influenza vaccination, it would help to provide immunity to those at the extremes of ages, the under 5 and the over 65.
So as we wrap this up a little in a few minutes, for our staff and maybe Anson and both you and Dr. McNeil, where can our staff get the vaccination? I know we offer in the building, but what are some of the things we're doing, Anson, to make it available to staff and people in the community? Where do they go to do their part in getting immunized?
Yeah, that's a great question, Darryl, because things are different in the community right now. Mm-hmm. A lot of family doctors and community-based nurse practitioners, primary care providers are working virtually, and so we do have to know where in the community we can get our vaccination. It's really straightforward for our staff here at Ontario Shores and our patients, of course, because we have a very well laid out process for vaccinating our staff, where there's multiple opportunities to get the vaccination. So for our staff and for our for our patients, we've been putting together a plan since the spring, actually, to be able to roll out in a seamless manner various clinics, both on unit and in occupational health, to vaccinate our staff. Now, some people do prefer to go to the community, and we know that our pharmacies are very active in influenza vaccination, and this year will be no different. Still, if your primary care provider is providing face-to-face visits and immunization, then certainly to take take that opportunity if that's your choice. The important thing is that we know as an organization whether you've been vaccinated or not if you're a staff member. So if a staff member does decide they want to get vaccinated in the community, it's very, very important to contact occupational health and provide proof of vaccination and allow us to know what our actual rates are.
And to add to what David said also too, is we do make it easy for staff to let occupational health and safety know if they've been vaccinated elsewhere. We do have an attestation form that is on Shoreline, and staff can simply fill that out and say that they got vaccinated and on what day, and they will also get a full-size chocolate bar as well.
Great. So for people in the community, while this, I guess they're still sorting out vaccinations, you can visit publichealthontario.ca. I imagine shortly there'll be information as the province rolls out their influenza campaign. So in closing, get your flu shot, help us get rid of this thing as soon as possible so we can get back to living our lives. That's what I'm hoping comes out of this. So thank you both for joining the podcast and being part of this discussion. Really appreciate it.
Thanks so much for having us, Darryl. Thanks so much.
Thank you very much, Darryl. Appreciate it.